I am Dr. Prashant Kewle. I am a ENT surgeon at Apollo Spectra, Chembur, opposite Devar bus depot. Today we will talk about something about the ear a common person should know, so that if anything is there, they can come back to us. Before understanding the problems in the ear, we should understand the anatomy or the structure of the ear. Because if some problem is happening, we should know from where the problem is happening. So, I will first explain the structure of the ear in common man language so that we can understand what I am talking about and which part I am talking about. So, let us see the diagram which I have drawn. Okay. So, this is the structure of the ear, but what we see is only this part. This is called pinna. The pinna, the function of pinna is to collect the sound wave and direct it to the canal so that the sound waves will directly impact onto the tympanic membrane. इसको हम कान का पर्दा भी बोलते हैं. Now, this is, we say, external ear till the tympanic membrane. From the tympanic membrane, there is a structure or there is a section which is called middle ear. And then we have the inner ear. After this is the structure of the inner ear. Now, this is your pinna, which is going to direct all the sound waves through the canal. They will go onto the tympanic membrane. Now, tympanic membrane is eardrum. It is just like the covering of the drum. How the drum will vibrate, similarly, the tympanic membrane also sets in vibration. And the sound energy is collected and will be transmitted via this chain of bone. The first bone is called malleus, second bone is called incus, and the third bone is called stapes. Once the tympanic membrane vibrates, the malleus will vibrate, then the incus will vibrate, and then the stapes will vibrate. Once the stapes will vibrate in this direction, there is a fluid in the inner ear which will set into vibration, and there are small filament, around 32,000 filaments are there, which are responsible for the hearing. So there are different filaments which are located at different location, and accordingly those filaments will transmit the information to the brain about the sound quality. So there are 32,000 fibers, and this is a 2.5 ton of structure called cochlea. Cochlea is nothing but your computer processor. It will just process what frequencies and at what interval they are coming. And then the whole process system will be connected to the brain by this cochlear nerve. Cochlear nerve will take all the signals to the brain, and in the brain you will have analysis of what you are listening. So the structure is completely like this. For better hearing, you should have a good ear, the good eardrum. The ossicular chain is also important. The fluid in the cochlea itself, the function of cochlea should be good, and the nerve which is carrying the signal to the brain is also should be good. And in the brain, there also, if some problem is there, you may not understand what you are listening. So this is the hearing mechanism what I talked about. Now, why you need this in the middle is our amplifier. When the sound comes onto the drum is quite a large, it's an 8 millimeter structure. And from there the sound is impacted to a very small oval window and the sound gets double. Why you want to double this sound? Because we know the inner ear cochlea is having fluid. Suppose if you are swimming in the water, you will get less hearing. Accordingly, there is a fluid inside. So to take care of this fluid mechanism, we need to amplify this sound. And therefore, the sound amplification system is there with us. If there is any problem in the amplification, the sound may not reach the inner ear properly, and you may not analyze or you may not hear properly. So now, what are the causes, the commonest causes what we are going to face? If suppose you are having difficulty in hearing, it can be from the pinna. If the pinna shape is not good, if there is no pinna, there will be some loss of sound energy. Suppose this is a canal which is blocked because of wax or any other foreign body or any infection. That infection, suppose if it occludes the canal, it will give rise to the difficulty in reaching the sound waves to the eardrum, and you may have decreased hearing. Now let's come to the drum. If the eardrum is not intact, if there is a perforation in the eardrum, that much sound energy will not be transmitted inside the ear. So this could be the cause if you are not able to hear properly. Now suppose the drum is intact, everything is good, and still if you are not able to hear properly, what does that mean? That means there could be problem into the middle ear. Now middle ear is such a structure which is filled with the air, and this air will come from the eustachian tube. This tube will open behind the nose. So when you are breathing normally, some part of air will go through the tube into the middle ear. Why this is required? Because middle ear will have pressure equalized to the tympanic membrane. This is the external ear and this is the middle ear. So to equalize the pressure, we have an equalization tube. And if there is any pathology in the tube, that will give rise to a negative pressure here and will give rise to retraction of tympanic membrane, or the chain will not move properly because of negative pressure. So the middle ear aeration is also very important by the eustachian tube. If you have a cold in the nose, because of runny nose, the water may go through the tube and may come into the middle ear. If this is happen, what happen? Because of fluid in the middle ear, this system will not vibrate function properly, and therefore you may have decreased hearing. So in the cold, sometimes you get an ear block, and that block is because of the cold reaching behind the drum. Everything will be normal from here, but behind the drum there could be cold, and that can give rise to decreased hearing as well. Now suppose if you don't have cold and still there is a blockage, what can be the cause? This bony chain, I told you this bony chain is going to transmit the sound to the inner ear. If the bony chain is broken because of any accident, then what happens? This sound energy will not reach here and you will not be able to hear. One more thing can happen. This bony chain is fixed because of some pathology called otosclerosis, wherein the stapes, the third bone, will be fixed. So this will move, the second bone will move, but the third bone will not move, and the sound will not be able to reach the cochlea. Again, you are going to have a decreased hearing. Sometimes you have an old infection and there is a plaque kind of structure inside called tympanosclerosis. With this plaque, there could be plaque here and it will hamper the mobility of the chain and will give rise to a decreased hearing. So here we are seeing the normal tympanic membrane, but the pathology in the middle ear, to summarize, is fluid in the middle ear, negative pressure in the middle ear, fixation of the ossicular chain, or fixation of the chain by tympanosclerosis or otosclerosis can give rise to decreased hearing. Now till this point, everything can be corrected by simple surgery or medication. What do I mean by that? If there is a wax here, we could put wax eardrop, dissolve and remove the wax by simple syringing or watering. If there is any pathology, say fungus or some foreign body which can be removed, so this can be treated curable, right? If there is any bone formation, osteoma, again can be cured by surgical method. If there is a developmentally no pinna or no canal, or this canal is completely obliterated, again it can be corrected surgically. I told you the second, that is the tympanic membrane. If there is any perforation in the tympanic membrane and giving rise to decreased hearing, we can put a new tympanic membrane by just taking a small tissue inside the skin that can match to your tympanic membrane and you can get a normal hearing. Now, if there is a negative pressure or if there is a fluid, we can treat by giving nose drop, steam inhalation, antibiotics, antihistaminics, and we can take care of this tube pathology. And this fluid can be again come back to the nose and you can get air inside and your block may be open up. So minimal medication but timely medication. If the medication is too late, then this fluid may get solidified. And then we may have to open up, giving a small nick here and take the fluid out. And then the air can be proper in the middle ear. So this can be managed either by medicine if you come early. If you are late, we may have to do myringotomy and put a small incision in the drum and take the fluid out. And then put a small grommet inside if it is too thick fluid. So this pathology can be managed in that way. Then the bony chain. If the bony chain is blocked or fixed or broken, again it can be corrected by simple surgical technique. We can remove the plaque, we can drill the hole in the foot plate and we can remove the stapes and we can put a new implant from here called stapedectomy. So these simple surgeries can amplify your hearing again back to normal, near normal I mean to say. Now, if we come to the inner ear, now this is your computer. If this processor is damaged, then you may not be able to restore it permanently and to the normal. Why? Because it is very sensitive tissue. The fibers are very sensitive. If the fibers are dead, they are dead permanently and we may not be able to replace them. But yes, now we have something called cochlear implant. Let us see why we will damage this cochlea. What are the reasons this cochlea can be damaged? Now, this cochlea, we can see from the structure, the drum and then the sound energy will be transmitted inside the cochlea. Now, suppose if you are exposed to high sound for a long time, what will happen? The impact will go to the cochlea. Continuous impact, vibration to the filaments will damage the filaments. And then you may get permanent hearing loss. So we say no to loud sound, no horns, no loud sound exposure by means of loudspeakers, continuous use of your headphones to hear music at higher sound levels can give rise to the damage to the cochlea, which will not be able to correct. So this can give rise to permanent damage. So these factors are in your hand. You can prevent this damage, which is human error or which is human mistake, to give rise to permanent hearing loss. So now suppose somebody is born with a defective cochlea. What we can do? Then we can put the option of cochlear implant. Yes, if the whole cochlea is, only this processor is damaged and the nerve is good and the brain is good, we can put a cochlear implant. What is cochlear implant? It is nothing but a small electrode and it is having around 32 electrodes, and that electrodes will go in the cochlea and they will represent all the frequency required. So when the sound energy will come, then these frequencies will be stimulated and similarly processing can be done. The processor is somewhere here in the bone and the cochlea, the implant will be going through the round window inside the cochlea and it will replace the fibers by means of electrodes, and then these electrodes will stimulate the nerve and you may get normal hearing. This option we choose mainly if the cochlea is damaged more than 50%. In people who are born with some defect in the cochlea can be done. Old age people, because of old age also these fibers can get damaged and we can opt for a cochlear implant. So this mechanism can be corrected by means of cochlear implant, but it's a costly affair. If the nerve is damaged, at the moment there are no easy surgeries for this, but yes, we can have brainstem implant, which is there in the line. Few people are doing it, but then what I recommend is you can take care of your cochlea by giving good sound energy and not the loud sound. So say no to the loud sound or loud music and you can preserve your cochlea. Some infections here and there can give rise to the infection. If you are finding decreased hearing, come early to the ENT surgeon. We can just examine and find out any blockage here. We can examine and find out any problem in the tympanic membrane. We can get idea about the middle ear as well. We can do a simple testing and find out the chain is blocked or not. And we can also have an idea whether this all system is good, but your cochlea is getting damaged. If the cochlea is getting damaged and because of some medical condition, immediately within 8 hours, we have to start the medication. If your cochlea has to be preserved, we have to start the medication within 8 hours. And there are some chances of recovery of this nerve damage. Otherwise, after 8 hours, the chances of recovery becomes very much less. So, you should be fair enough to reach the surgeons or ENT surgeon if you find there is a difficulty in hearing. It could be a simple structure to a complicated structure which can give rise to the decreased hearing. Now, this is one mechanism or one function of the ear, that is hearing. What is the other mechanism or what is the other function of the ear? See this small structure here, it is called balance system. Now, this balance system is also into the inner ear, and this balance nerve goes along with the hearing nerve into the brain. So, what is this balance system all about? In the balance system, you have 3 canals: lateral canal, posterior canal and superior canal. They are like X, Y and Z axis to represent our head into the surrounding or into the system. They are the one who are going to send signal to your brain about your exact location of your head. Whether your head is straight, it is tilted, it is moved, all the information goes to the brain. So this is your sensor. There are 5 sensors, 3 canals and 2 sensors into the utricle and saccule. The first sensor is for acceleration and deceleration. If you are moving forward, backward, that sensor is in the utricle. And whenever you are standing, sitting, sleeping, all the time gravity is going to pull, and that gravity sensor is in the saccule. So you have 3 canals to give orientation of X, Y, Z axis, 1 sensor for motion and 1 sensor for gravity. So that gives the complete information to the brain about your head position in the surrounding. Accordingly, your brain will do the corrective changes into your leg muscles or your body muscles or your neck muscle to maintain the balance. So the balance system is a part of the inner ear. If this system is got infected or something, you may experience loss of balance. Everything may be surrounding. You may have what is called vertigo or chakkar in common man's language. So the function of the ear is not only hearing, but it plays very important role in balance as well. If the sensors are giving wrong stimulation to the brain, you will find everything around surrounding is moving around. So there are so many pathologies which we as a ENT surgeon deal, and that is called balance and vertigo. So vertigo is nothing but because of false stimulation, you perceive that the surrounding is moving, and you may say that you are having vertigo or chakkar. So, and because of this perception loss, you will be off balance and you will not be able to maintain the balance. You will not be able to walk straight. You will feel that you are falling on either side. That is because of some problem into the balance system. So, if you are finding that while walking, you just feel that you are going off balance sometime, then this is something with the balance system problem. If you are finding that everything else surrounding is moving around you and because of that you are getting vomiting, this is because of balance system problem. So this will also be treated if you come early. So you should understand that ear is not only about the hearing, it is also about the balance system. So many times we feel that chakkar is there, okay, sugar kha lo, okay, thoda sa ye kar lo, BP check kar lo. But you should also look at the balance system because the pathology may be in the balance system and the wrong information going to the brain can give rise to the balance problem. So you have to understand the balance system, the hearing system, all this system, the pathology in the nose can give rise to the any problem to the middle ear as well. So all these things, if we understand, it will be very easy for you to find out or reach us as early as possible. So with the diagram, we understood the reasons for decreased hearing and we understood the reason for balance system problem or vertigo or giddiness. Now, so many other things, common people will come. They will come with the ear discharge. Should we pay attention or not? Normally, there will not be a ear discharge. What do I mean by that? Suppose if there is a water flowing from the ear, it's a problem. It could be just water, it could be yellowish water, it could be thick yellow discharge, it could be very scanty water, but every time you clean, there is a yellowish discharge. So this is not normal. What is normal? Suppose if you are cleaning with the earbud and you are finding minimal brown color liquid, that is normal. It is the wax. The wax is nothing but a secretions. Like how we sweat, similarly we have a glands into the skin of the canal which are going to send some secretions, and this will be in the liquid form, will be a brownish color liquid, and that is wax. So just brown color wax minimum is fair enough, it is normal. But otherwise, if you are getting any secretion, watery discharge, yellow discharge, less discharge, more discharge, black color discharge, it is all pathological. You should be able to come. It could be some infection into the external canal, infection into the inner middle ear, could be from the tympanic membrane, granulation, tissue, fungus, it can be anything. Unless we check, we clean the ear, we will not be able to comment on it. So just if you are having ear discharge, nobody can give you eardrops unless that person clean the ear and see the reason why the discharge is coming. Because the discharge can be from the fungus, it can be from the allergy, it can be from the perforation into your tympanic membrane, or it can be from cholesteatoma. What is cholesteatoma? Cholesteatoma is a very dangerous disease wherein the skin of the tympanic membrane and the ear canal goes inside into the middle ear and it can expand. So because it can expand, you have the brain which is surrounding the middle ear. So above is your brain, behind is also brain. So if it expands, it may explode into the brain and can give rise to serious complications. So to understand about cholesteatoma, what features will be having cholesteatoma? Cholesteatoma will not have watery discharge. It will have very less discharge, but foul smelling discharge. Why foul smelling? Because it is the secretion which are there inside and they are going to get putrefied. They are going to get necros. And the necrosis is the one which is going to give foul smelling ear discharge. So if you have a foul smelling ear discharge, you have to come and get it examined. It could be cholesteatoma, which can be a danger. We say it's an unsafe ear. What is unsafe? Because it can explode into the brain, it can give complications, and therefore it is called unsafe ear. We need to go ahead as well as possible and do the surgery, remove all this necrosed bone and take everything outside into the ear so that nothing goes into the brain or other important structures. So cholesteatoma is something people should be aware of, that foul smelling discharge from the ear, you have to confirm why this discharge is there and you have to treat it properly. So these are the different types of ear discharge which can be there and the reasons behind the ear discharge. Now one common problem people come is ear itching. I do get ear itching. That is the commonest problem. Why there could be ear itching? Sometimes you have a dandruff and the dandruff will fall into the external canal and then that can give rise to itchiness. Sometimes there could be dryness into the skin and that can give rise to the itching into the ear. Sometimes it could be a symptom of allergy in the nose. So even itching, yes, to some extent, if it is very rare, should not bother. But yes, if it is again and again, then it will be troublesome. Because of that, you will keep on putting the earbuds. And once you put the earbud continuously, what will happen? The skin of the external canal will be damaged. Your skin is having such a nice cells which are having brush-like structure. So it will take everything from inside, the wax, everything will be thrown out. So you need not clean your ear with the earbud. If you are using earbud again and again, you are damaging this brush mechanism into the external canal. So that leads to more problems. So that leads to collection of secretions and infections and eczema and allergic reaction, because the earbuds, they will be having some chemical on it, and then that chemical can give rise to the allergic reaction. So this ear itching, if it is minimal, you can neglect. But if it is again and again, you need to put the earbud again and again, please do consult the ENT surgeon. They will give you the good solution, better solution, what is there and what is not there. So it needs to be examined. The ear is such that you can't see the drum directly. So you won't be able to do something by yourself. So we need a specialist to tackle your problem of the ear. Many times we get a lot of questions from people, should we clean our ear or not? So to understand, your ear, the canal skin is having a brush-like structure. So it will take away all the secretions from inside to outside. But if the brush is damaged by use of earbuds, then the things remain inside. So as far as possible, you need not do your ear cleaning. They are self-cleaning. The ear will get cleaned by itself. If some people have, many times lot of wax is formed. So some people have a tendency, like how some people will sweat a lot. Similarly, some people will have more wax. In that case, we do advise to clean the ear with the earbud. It is very much safe to clean the ear with the earbud, provided you do very lightly and at least once or twice in a month, that's it. If you are putting the earbud regularly, 100% you are going to come some other problem in lifetime. So yes, cleaning with the earbud, we have no problem. But what happens, suppose there is a wax form and then you try to take it out, you are going to push it inside. And then it will give pain, it will give trauma, you will get a lot of problems. So if you have a tendency to wax formation, what do I mean by that? Suppose you have a ear block, you went to the ENT surgeon, he cleaned the ear, he said there is a wax. Suppose this thing happened again and again. What does that mean? That means your body is having wax forming tendency. So in that case, once we remove the wax, now your canal is empty, you should clean the ear with the earbud twice in a month. Say on Sunday after bathing, you just clean once. So I told you the wax will be initially brown liquid. So the brown liquid, if it doesn't accumulate, it's not going to form the wax. So once we clean the wax ball, then you should avoid formation of wax ball by means of regular cleaning by yourself. That can be done with the earbud twice in a month and very lightly. And you what will get? You will get brown color liquid because it is initially is a liquid state. If you don't clean, it piles up and it becomes solidified and you get a wax stone. That's the later stage. After say 1, 2, 3 months, the same liquid wax will become a solid ball and will become a big hard wax. And then it will start paining because the wax is an ongoing process. Your body is having wax forming tendency. So the wax will keep on adding, but the canal is limited. So it is going to press the skin inside and give rise to severe pain. And then the pain, the swelling, if you still ignore, what happens? The skin will get compressed and will form a polyp mass, which can be seen from here, bleeding. So some of your ignorance can lead to this kind of trouble, and we have to just take it under anesthesia because the polyp is painful, a touching of ear is painful, the wax is going to be there again and again, it's going to increase only. So avoid this. If you have wax tendency, fair enough. You have to first get it clean completely from the ENT surgeon once the canal is empty. And if you have a tendency, you should clean your ear regularly every 15 days and you will not get the problem of this wax stone or wax formation again and again. Many times we get a patient who tell about the ear piercing, and the earlobe is damaged because of using high or heavy earrings. So what should be done? Ear piercing is not a problem. Some people will develop reaction. It is called dermoid. So these keloids can be there. That could be the tendency to the person. So it depends person to person whether you will have this keloid kind of reaction. What is keloid? The skin will get hypertrophy, and at the point you will get a swelling again here and front also. So in those people who got a keloid, definitely we advise not to do again ear piercing. Otherwise, common people, yes, ear piercing can be done, provided it is done with all safety measures. Then it will not give trouble. But if at all after ear piercing, if you are getting any redness, swelling, pain, definitely come to the ENT surgeon as early as possible. Because if there is an infection, because of whatever your instruments are not good, they are not sterilized, and the infection sets in, your pinna is very sensitive. This cartilage, once start getting infected, it will get necrose and you will get a drooping like this. You will get a cauliflower pinna. So, to avoid all these things, if at all, after doing ear piercing, if you are getting any trouble, pain there, you should consult ENT surgeon. Second, about the earlobe repair. It's a very normal and small surgery, can be done, and there is no problem. People all bother about whether we get repeated surgery again and again. So if you go for sutureless surgery, you put a glue, and even that works. There is no problem with that. But yes, sometimes that may give trouble, and simple suturing will take care. So earlobe repair is something which can be done and not a problem as such. Ear piercing can be done, not a problem. Unless you are having any trouble, you should come to the consultant to take care of your problem, to avoid some complications from that. Thank you.